Okay, ladies and gentlemen, let's turn now to the last portion of our evening program that focuses on something that everyone here cares about, and that is humanitarian relief. The concept comes from, it's part of our makeup, our DNA, and from our hearts. And tonight we are honoring the work of the King Salman Humanitarian Aid and Relief Center, better known as KSRelief. We're proud to present KSRelief with the National Council's Global Humanitarian Achievement Award. It was inaugurated in 2015 by the custodian of the two holy mosques, His Majesty King Salman. KSRelief has emerged onto the global stage in less than a decade as the world's leading managers and providers of humanitarian relief and assistance. KSRelief, which is headquartered in Riyadh, has provided assistance in over 100 countries, Asia, Africa, Latin America, and elsewhere around the world. It addresses human suffering by focusing on those most in need, especially in the areas of food security. Building on decades of generous Saudi philanthropy and now formalized within Vision 2030, KSRelief has become the main conduit of Saudi international assistance. It partners with many other organizations and provides needed leadership in the humanitarian space. The custodian of the two holy mosques, King Salman bin Abdulaziz, inaugurated KSRelief with the following statement, which, if it looks like I'm reading, it's because I am. I don't want to mess this up. Islam teaches us that we are responsible for helping the afflicted and the poor, and that we must also attempt to preserve human life and dignity whenever possible. The King Salman Humanitarian Aid and Relief Center is dedicated to coordinating and providing international relief to crisis-afflicted communities, alleviating suffering and providing the essentials to allow people everywhere to live good lives. Our primary goal is to operate this center solely on the basis of humanitarian need and without any other motive. To run the center, the kingdom appointed an individual who is beloved and renowned throughout the world. Dr. Abdullah A, Rabeeah, who is here tonight to accept the reward on behalf of KSRelief, and I'll have more to share with you about him in a minute. But before he speaks, please let me present the award. The National Council's 2024 Global Humanitarian Award is awarded to KSRelief and will be accepted by Advisor to the Royal Court and Secretary General of the organization, Dr. Abdullah Rabeeah. Please join me on the stage. If I was really any good at this, I would have done all this before he got up here. Doctor. Please stay here. Thank you. Hang here for a second. Hold on. Don't go away. Ladies and gentlemen, I also have a, Patrick, we do have the video? Yeah. We have a surprise video from an individual who is very much admired for his work in Gaza. He couldn't be here joining us this evening due to disastrous flooding in Spain, but this is a video that Chef Jose Andres created for us to enjoy just for a second. If you just hold on.
Good evening, everyone. It's Jose Andres, and I'm here in Valencia, Spain, where the NGO I founded, World Central Kitchen, has been feeding the survivors and the first responders after the devastating floods here. So thank you to Mr. Roosevelt and everyone at the National Council on U.S.-Arab Relations for inviting World Central Kitchen to be part of this special evening. I'm sorry I cannot be there with you in person tonight, but I'm cheering you on and celebrating your achievement from afar, but in a way my spirit is with all of you tonight. Since we founded World Central Kitchen already almost 50 years ago, we have carried out our work with one very simple mission in mind, one I think you will share: to bring food and water to people in their moment of need and be alongside them to show them that someone cares. A plate of food is a message of love. In the process of serving hundreds of millions of meals from Puerto Rico to Morocco, from Ukraine to Gaza, we are fortunate to always find great partners and volunteers who want to join us and support our work in the most meaningful ways. Tonight, I want to extend my thanks to His Excellency Dr. Abdullah for everything you and the King Salman Humanitarian Aid and Relief Center do to build a better world. Congratulations on this prestigious award. This recognition is well earned, and I know it's only the beginning of all the life you will continue to touch. We look forward to partnering with KSRelief to continue to bring much needed food relief to communities in need. Thank you again for your wonderful work, and I hope you enjoy the evening. Salam alaikum. Thank you. Good evening.
So, Your Excellency, for decades, you have done so many wonderful things and been such a humanitarian in your own right. Tonight, we at the National Council would like to recognize you personally. For decades, you provided unparalleled leadership in global health and humanitarian relief. You have led the center admirably and transformationally to the premier global organization for monitoring, coordinating, and provision of aid to the world's neediest. But this is just one part of your makeup and your humanity. After studying, just so you all know, after studying in Saudi Arabia, Dr. Rabeeah interned at some of the finest medical establishments in North America. He then became a brilliant trailblazer. This was in the field of separating conjoined twins. Since 1990, he and his team have performed 61 separations of conjoined twins and have worked with teams in 26 countries in over 142 cases. Yes, this person next to me is the world's famous doctor that you have all read about, and if not read, you've heard about. The miracle doctor separating conjoined twins in Saudi Arabia. His work led to a groundbreaking book on this experience, separating conjoined twins, along with publications in 3 other books and over 100 scientific journals. He's also served as Saudi Arabia's Minister of Health, transforming that ministry as he transformed KSRelief into a high-functioning modern institution that it is today. Saudi Arabia trusts Dr. Rabeeah to innovate and transform institution and save lives, and so do we. It is also important that Dr. Rabeeah's relationship with the National Council is not new. We've been working together since 2016, after he was invited to an event that we put on in Capitol Hill, a briefing up there, which followed other briefings that we organized on the Hill a couple of years later. Dr. Rabeeah, we've been so privileged to work with you, to learn from you, and to be a part of your journey over the years with regard to your relationships here in the United States, in particular in the Washington, D.C. area. On behalf of the National Council and its management and staff, It's my honor and privilege to present you with the 2024 Global Health and Humanitarian Leadership Award. Thank you very much. Please. Did you get that? Okay, here he's right here. Wonderful. Dr. Rabeeah, thank you. Here, this, huh? We're going to check the power. Okay. Technical check.
Screen, please.
We good? Okay. The pointer's over there if you need any help.
No, I'm fine.
Okay.
Well, thank you, Delano Roosevelt. I'm really thrilled and privileged to be here tonight. I'm not like Dr. Abdulrahim Fukara. I'm not a journalist, so I come after him, so you have to expect my limitations. And I will seek your assistance, Abdulrahim, if I have an issue with my addressing. Well, let me start by addressing the audience, Your Royal Highness, Prince Turki Al Faisal, Your Excellency Delano Roosevelt, also Your Excellency Dr. John Anthony, and also the Chairman of the Board, John Pratt, and also the members of the board, and also my friend, Colonel Daouk. Excellencies, ladies and gentlemen, I'm really here tonight, not only honored and privileged, but also happy to address such respectable audience. And this is not the first one with the Council. I have started, as Mr. Roosevelt mentioned, in 2016, 5 times. 2 of them were physical and 3 were virtual, addressing a noble goal, which is the humanitarian arena. But before I start addressing you, I used to be an academician, so I use the PowerPoint. I believe that visual and also audio speech will probably stick in your mind for a long time. But I was really touched by my predecessor speakers. Let me start with Sarah Dodd. I'm really touched by your words and speech. And let me give you an opportunity. When you I was an intern many years ago, not 2 years or 3 years, but many years ago. And at that time, when I finished my degree, one of the biggest challenges is to start building the experience. And here you have an opportunity. You can come to us and visit in KSRelief and learn the other side of the world. Now, the other speaker, who is Dr. Abdulrahim Fukara, he's a journalist, and he was addressing very sensitive issue about the politics and also the relations between the US and the Arab world. Well, what actually caught my mind in his speech is bloodshedding and the umbilical cord. And I am a pediatric surgeon, and I shed blood. I have been shedding blood since I graduated from medical school. And I love to shed blood, and also I follow the technology. But I shed blood different than any politicians. I shed blood to save life and bring a smile to parents and children of the world. I was invited many years ago by one of the embassies because we have separated so many twins. By the way, a lot of twins from actually Morocco and from other parts of the world, including Europe, Asia, and Africa. And they told me, you have a speech. I did not prepare any speech. And all of them were ambassadors and politicians. I told them, well, the only thing that we come in together is the blood. But there are 2 pictures. One, blood is shedding, is going to grave, and the other one is showing a picture of a child who is smiling which I'll show you later. Now, I will address you, as requested by the Council, what is KSRelief is doing. But let me start about the challenges. Dr. Abdul Rahim actually touched me when he talked about the challenges. And if we talk about political challenges, they are not far from humanitarian challenges. Now, the first challenge when we talk about humanitarian work is actually the increasing number of crises. Now, we have crises. These are only examples. In Palestine, 3.5 million actually either displaced or become refugees. In Sudan, the number is higher, 24.8. And in Lebanon, already 1 million are already displaced or become refugees outside in a reverse migration back to Syria. The problem is that, which I address later, is the more you have crisis, the more you are draining the limited funding for humanitarian assistance. Now, the other issue is increasing also administrative and logistic costs. As we move in our life, we will have more cost for transport because of COVID-19 and others. And this is another burden which is actually facing us humanitarian to deliver aid, because we have only limited amount of money, and then we have costs that we have to address, whether it is administrative or logistic. The other is the lack of funding. If you talk about the funding countries, there are actually literally 10 top global countries: US, Saudi Arabia, Germany, and the EU, and the GCC countries. These are the top 10 donors in the world. The rest actually, and those 10 count for 70 to 80% of the global humanitarian funding. And look at 2024, there has been a need close to $50 billion US. Out of that, only 37% was funded. So look how much we have helped the people. Only 37% of what are the need for millions of people who are either cannot have a meal, or they are sick and they're going to die, and many other issues. Climate change, and we know it all. We have seen the natural disasters and flooding that all of you are well aware of it. And you have seen the labile economy that we have met. We have seen it in COVID-19, and we are seeing it now today, which has adversely affected the resources for humanitarian work. And then with crisis, there are issues also related to access. We have seen it in Gaza, we are seeing it in Sudan, and we are seeing it also in Ukraine and other parts of the world, and now in Lebanon. The other is aid diversion. Anybody who says aid is impartial and neutral doesn't know humanitarian work. Aid, with the politics that are existing now, is not totally impartial, unfortunately. And that's why there is aid diversion, and there are also threats against aid workers. Not only threats, we have seen how many hundreds of humanitarian workers who have been either injured or killed. Now, I'll take you to KSRelief if you allow me. Saudi Arabia history since 1975 till today has spent more than $133 billion US in 170 countries. Now, KSRelief, which actually, Your Excellency, Mr. Roosevelt, you have addressed very well. It has been actually an inspiration of our custodian of the two holy mosques since he took actually charge of the country in May 15, 2015. And his vision, our vision came from his speech, which is clear to you, is to become a leading center for relief of humanitarian activities and transfer our values to the world. I like the word DNA. Actually, humans, the DNA of humans is actually imprinted with the love to help and support. The issue is do you have the atmosphere to do that and the capacity to do that? And also our mission came from His Majesty. Now, I love those core values, and I can tell you KSRelief adheres to those values. Unfortunately, in practice, the world is different. Impartiality, which is very important when you do humanitarian work. Transparency, which is very important also when you do humanitarian work. And you have to have a very high quality, and you have to be professional when you do humanitarian work. And also, you have to be initiative. You cannot stand on what the people have been doing. You have to have a research, R&D, and also you have to have initiatives and be creative. One time in Yemen, the city of Taiz was completely blocked by the Houthi militias, and nobody can enter. So we have found great ideas. We can do airdrop for medications and some food supplies, but oxygen cylinders cannot be airdropped. You know that. And there are 4 hospitals, and there are hundreds of patients who will die because there was no oxygen. What we have done, we took the oxygen cylinders on the back of donkeys and on donkeys and camels, and that they have gone through the mountains, breaking the siege of the Houthi militias. These are the creativity, although it is actually primitive, but sometimes can be very intelligent. Now, you cannot do humanitarian work without having very strong governance. And without governance, you will not be able to do that. And KSRelief applies the highest standards of governance. Now we have 11 branches in different continents of the world. And also, we adhere and work in the 12 or 13 sectors of humanitarian work. You have heard that now food security comes first, health and education, nutrition, early recovery, and also emergency and water and sanitation. But one thing that KSRelief is different, we support and promote volunteering, and I'll talk about it later. Now, since the inception of KSRelief, we have implemented over 3,100 projects in 104 countries with a budget exceeding $7 billion US. And these are the top countries, and Ukraine also comes now with those top countries because of our work in Ukraine. And also, I addressed initiatives, and we love to do initiatives. But when you do work in fragile countries, or actually disabled countries, or countries with crisis, you have to support the fragile sectors of the society. And if you support women, you are supporting the community, you are supporting the family, and that's why KSRelief is a woman-focused organization. We have more than 1,000 of our projects directed to support women, reaching more than 153 women globally. Same thing for children. You cannot do humanitarian work without supporting also children. We have close to 1,000 projects to support children in the world. We have reached over 180 million child globally with many initiatives to promote their lives. Another also unique initiative, people say, why a doctor who's a pediatric surgeon will talk about demining? This should be left for the military, and we have Colonel Daouk here. Actually, demining will be paving the way for doing a good humanitarian work. You cannot have children go to school with the landmines like Yemen and elsewhere. You cannot have, for example, agriculture with the landmines. And that's why we took on our shoulder to do a project called Masam, which is demining. In Yemen, we have demined close to 500,000 landmines, and we have a long way to go. And we have done that in other parts of the world, like Azerbaijan and other parts of the world. Another thing, I'm a doctor, I'm biased to medical issues, but if you have a landmines, you will have amputees. And without an artificial limb project, you cannot actually bring hope to many children, women, and others who have lost one of their valuable limbs. And that's why we have, alone in Yemen, 5 amputee centers, and we have them for the refugees in Turkey, and also now in Lebanon and other parts of the world. Other project which is close to the heart of Colonel Daouk is a project we call Kafak, and this is really emotional. In Yemen, we have noticed that the Houthi militias have recruited 20,000 children to be in the front line of their militias. And those children are in the age of 7, 8, or 9 years of age. Imagine a child, I'm a pediatric surgeon, I know children. Imagine a child who's carrying a weapon or a bomb, and he is 7 years old, and then if he dies, they will put him a hero. You are actually creating a long-lasting bomb of a future terrorists. And that's why we have created this project, which we have taken those children in a counseling project, which has psychological, educational, social, and family counseling to bring those children to their noble life. I'm trying to speed up because your time is valuable. Another also initiatives is that the center has created many platforms. One of them is the Saudi Aid platform. You could see all of the aid of Saudi Arabia interactive online so that you know how many projects in which country and where they are, documented and authenticated by the UN FTA system, by the OECD DAC, and also other systems to ensure that these projects have been put online with transparency. Same thing for volunteers. Many people think Saudi Arabia doesn't have, refugees. Saudi Arabia has actually refugees, but we do not call them refugees. We call them visitors. And in their IDs, they are called visitors. And we have over 1 million in Saudi Arabia. Same thing for donation. KSRelief is not totally government. It's actually semi-government. We receive funding from the government, but also we receive from the public, and we have a digital platform called Sahem, which is on both Android and iPhone. Anybody can donate on that platform. And the volunteer also platform, young boys and girls from Saudi Arabia and elsewhere can actually become volunteer by applying online. These are the number of refugees we have in Saudi Arabia. We have them from Syria, Yemen, and also the Rohingya minority. And also, we provide aid to refugees, whether they are in Jordan or actually in Yemen or in Somalia or elsewhere. Now, one of the projects that I love most is the volunteering projects. Actually, we started this 2.5 years ago. Until today, we have implemented 774 projects in 50 countries. These are young boys and girls. Most of them actually are health workers. They go to a remote or conflict country, and they do from simple things to the open heart surgery. Actually, in Sudan, before this war, we have done liver transplant by our volunteers. Imagine we do liver transplant to promote the capacity of the country, or open heart surgery. This is what we do, and this is what brings value to those disabled countries. Now, let's address the current crisis, Gaza. We have heard from Dr. Abdul Rahim about Gaza. And actually, let me thank also the Central Kitchen for their World Central Kitchen for their really initiative, and I appreciate their compliments, and we hope to work together. We have already met virtually, and we hope to meet physically, and we'll put our hands together. But in Gaza, we have till today, we have actually worked to the budget exceeding $186 million. We have sent through an air bridge more than 54 planes, more than 400 trucks have actually gone through the corridor of Rafah, but unfortunately we have another 400 trucks waiting in Rafah to be allowed to go in. We have sent more than 8 ships to Egypt, and also with the Royal Force of Jordan, we have used the airdrop mechanism, which is usually limited. And we have also signed with many valuable partners like UNRWA and WHO, ICRC, and others to implement projects inside Gaza. Unfortunately, the limitation is high and difficulties are high. And we have last week have a small hope that some of our trucks managed to go from Jordan to north of Gaza. We hope to see more of those corridors open. We wish sooner than today, before tomorrow, that all the land corridors will be open, and we will allow some hope for children, women, and old people who have nothing to do with this conflict. Now, Sudan is another also problem, and another actually self-fighting and difficulties and challenges. We have also implemented projects with a budget exceeding 120 million, an air bridge of 13 plane. We use the sea, more than 31 ships. We have 60,000 tons of food baskets, and we have worked with all of those valuable partners in Sudan, and including, by the way, our medical volunteers are going to Port Sudan to help the health system in Sudan. Ukraine, another also challenge, and I'm sure you know it better than me. Again, Saudi Arabia has allocated 400 million US dollars, 300 in the oil products and 100 in the humanitarian. And we have also worked with both UNHCR and WHO to help the Ukrainian refugees in Poland and elsewhere. We have also now, we have just signed projects with both WHO, UNHCR, and WFP and others to support the civilians in Ukraine to go over their challenges. We have, based on the request of the government of Ukraine, we have actually sent more than 125 ambulances, more than 10,000 bed mattresses, and also devices and generators based on their priority list. And also the natural disasters that we have seen in Turkey and Syria. We have seen the disasters, we have responded immediately, and now with the stability, we have noticed there are over 1,000 children who are deaf, born deaf, and they were neglected. And for humanitarians, they used to believe that you cannot do cochlear implant for refugees or for IDPs. Well, we said, that's a thought, but let's try it. So we tried 10 of them, and it was the best success. So we have decided to do the 1,000 children, and if this report we have done, we have done 120 cochlear implants in one day. This is a world record in actually developed countries. To do it in one day, this is a world record. And we are determined to continue this in Africa and other parts of the world. Now, also we have built temporary houses for those who are actually they have lost their own houses. And in Lebanon, actually the number here is 70 million, not 7 million, 70 million, 0.4. Actually, another beginning challenge. And we have started an air bridge. I think as of today, 21 planes reaching the displaced people in Lebanon with food and health supplies and shelter. And also we have noticed that children are actually the most affected in Lebanon because of lack of baby formula, and we are sending baby formula for children in Lebanon. The magnitude is huge, and we're trying to work with our partners, UN and non-UN and local partners, to support the people of Lebanon, and we hope this actually conflict stopped today before tomorrow. In Yemen, I will also share with you what we have done. People used to say that Saudi Arabia was part of the coalition, and how can KSRelief works? My answer to them, 2/3 of our work is in the north of Yemen. If you talk about the hospital in Saada and Hajjah, these are the hubs of the Houthis. These are operated by KSRelief. So we are not penalizing the people of Yemen because they are living in governance under the Houthi militias. We care about the people of Yemen, irrespective of where they live. And we have proven to the world that we have applied the international humanitarian law. We have been impartial in Yemen, and our partners actually can prove our impartialism. And also in Yemen, like other parts of the world, we are paying attention to women-focused projects and child-focused projects. And I will, one word or two about the Saudi National Conjoint Twins Program. And people say you bring it because you have started this program. And no, I bring it because it is a purely humanitarian. And Saudi Arabia has started this in 1990 till today. As you have heard from His Excellency Mr. Roosevelt, more than 143 cases has been reviewed, 61 cases have been separated. We have 7 sets to be separated in the coming weeks. They are from 3 continents and 26 countries. This is a picture. This picture, I love it. Children from different colors, different countries, different religions. And we have heard the umbilical cord, and we talked about the US-Arab relationship. Conjoined twins are, or identical twins, are the only twins which have one umbilical cord. And I do separate conjoined twins. I separate bodies, but I bring hearts together, and we hope the hearts will also come together. This month, based on the request of Saudi Arabia and our king, and the hard work of the Foreign Ministry of Saudi Arabia, with the support of more than 70 countries, the UN has called the 24th of November as the Conjoint Twin Day, and Saudi Arabia, based on the request of His Majesty, is hosting the first ever conference on conjoined twins. If you have time, you are more than welcome to come and attend. It will be not purely medical, it will be medical, humanitarian, and also social for the life of those handicapped children. And this, before I conclude, we have also another invitation for you on February 24th and 25th. We are hosting the 4th Riyadh International Humanitarian Forum. This is an important forum where leaders of humanitarian work from all over the world, they come and sit for 2 days to bring value and future for humanitarian work. And we have already sent invitations to the heads of the US Arab Council, and we hope to see all of them in the conference. But this conference actually is a very stimulating actually and brainstorming conference, and feel free to come and join us there. And these are some of the global initiatives we have done with Gates Foundation, WHO, and UNICEF, an initiative to eradicate polio and help over 3 billion children who may have a problem in the future. And Saudi Arabia has supported that with $500 million starting this year for the coming 5 years. And also, we have signed with also the Islamic Bank a $3 million project to eradicate polio in Afghanistan. We have another also noble project with Gates Foundation, which is the Life and Livelihood Project, which actually transform communities from dependent on aid to be self-sufficient. And this program has finished 5 years, and now we are starting another 5 years of hope for those communities and countries. These are some of our valuable partners, and I think I have taken more than my time. I want just to conclude by, from the depth of my heart, thank the US Arab Council, and special thanks to the leaders of this council, who are now more than just leaders. They are actually becoming friends, and we have bonding between us,